Have you been thinking about losing some weight, but you've been discouraged because your body mass index, the BMI, is so high that you think, I'll never get it under 25? I'm Dr. Hamilton-Stubbs. I'm a double board certified sleep specialist, a certified nutrition specialist. Welcome to my YouTube channel. If you haven't already subscribed, I hope you will, and don't forget to hit notifications so you'll know when I upload my next video. In this video, I want to talk to you about the BMI and the Body Adiposity Index, or the BAI. So let's jump right in. The body mass index is a calculation that's been used for years to screen large populations for the risk of disease associated with your body weight. When we look at large populations of people, we can kind of get an idea of who looks like they might be overweight, but the body mass index gives you an actual number, a baseline where you can start if you are attempting to either gain weight or you want to lose weight. So in the past, we've been using the body mass index exclusively to determine if a person is at the normal weight, overweight, or in one of the classifications of obesity. So a normal BMI is 24.9. Now, you could calculate that out manually, or you can just go to my website and look for the blog post for July, and I have a link there that's going to let you just plug in your height, weight, and you'll be able to calculate that out on a little tool that's free, and it'll give you a number. And what we would do is use this number as a way to see if a person is at risk for certain illnesses. For example, a person with a certain body mass index could be considered at risk for obstructive sleep apnea syndrome, because we know that at least 75% of people with obstructive sleep apnea syndrome, where the airway closes completely or partially during sleep and is characterized by symptoms in the daytime as well as night, we know that about 75% of people with this condition are above their ideal body weight. And we have been using the body mass index to determine that. The problem with using the body mass index, according to the American Medical Association and others, but I'm referencing them because we're talking about their change in their recommendations. So what they have identified as problems is that the body mass index doesn't identify the percentage of body fat that a person has. So we've known for a long time that a person who's very athletic, muscular person, could have the same BMI as a sedentary person, your typical couch potato who has fat that has replaced those muscles. We would just get the BMI, but you could have the person in front of you and you could tell if you were dealing with someone who looked like they had a high BMI because of muscle mass versus someone who had a high BMI because of fatty tissue. The other problem with just using the BMI is that it doesn't take into consideration genetics and culture. So in some cultures, we don't consider them to be overweight if their BMI is 25. The other thing about the body mass index is it was used to screen these large populations looking for people at risk for dying prematurely. And the research has shown that the body mass index really doesn't do that very well. So you could have a high body mass index way above 25, but it wouldn't necessarily mean that you are at a greater risk for dying. So now the American Medical Association is recommending that you have two types of people with high BMIs. You have and that we should look for this. You have a person with a high BMI who may have some comorbid conditions that have been associated with obesity. And the two most common ones, hypertension and type 2 diabetes. But there are a lot of people who have a high BMI, but they don't have any of those diseases. So now we have what we call people who are the healthy obese and those who are at risk obese. So the BMI doesn't really do a good job of separating these two because it doesn't look at body percentage of fat. So now we are going to replace that with a couple of things. You can just replace the BMI with something called the BAI, or Body Adiposity Index. You can also call it the Body Adipose Index or the Body Fat Percentage Index. And what this is doing is the same, it's a calculation, but it's using something a little differently to come up with your score, your BAI index. So it's looking at your hip circumference and your height, and it has a little formula that can also be used very easily with technology. I mean, if you had to calculate either one of these out and you had a large busy clinic, it would definitely slow you down. But they're both available as little tools that you can plug into and put it in your electronic records, or if you're not a healthcare provider and you just want to get an idea for yourself, you can go to my website, look for my July blog. I've put the links in there so you can calculate out the BMI as well as your own BAI and get an idea of what the difference is. And either one of those can be used as a baseline for measuring where you're starting and where you want to get to. But for looking at your risk for developing some chronic illness like high blood pressure or type 2 diabetes, or your risk of mortality, premature death, you want to look at the BAI, or you can use the BMI with a few additional things like your hip to waist ratio, the waist to hip ratio, or just your waist circumference with your BMI to get a better idea of the percentage of fat. This video is part 1, and I'm going to do several of these because it's so important for us to take advantage of the opportunity to get healthier by controlling our body fat percentage. And this is going to give you a quick and dirty way to just get a baseline. So if you are trying to lose some weight, you can be encouraged. Your BAI is going to give you a little wider range, and it's going to help you understand the significance of your weight a little better than your BMI. So if this has been a helpful video to you, I hope you'll give me a thumbs up, and don't forget to share. If you haven't already subscribed, subscribe to my YouTube channel. I'd love to have you. And don't forget to hit notifications so you'll know when I upload the next video. If you go to the blog post and you have some comments or questions, or if you have a question after this video, leave it below so that when I make my next video, I can try to answer that question. Okay, take care, and I'll see you again next time.